Welcome to those who are joining us today. I am patient advocate Leanne Kramer, and we are going to be doing an interview with Dr. Ayal Aizer. He is the assistant professor of radiation oncology at Harvard Medical School, who serves as the director of the Central Nervous System Radiation Oncology at Brigham and Women's Hospital and Dana-Farber Cancer Institute in Boston, Massachusetts. He completed medical school at Yale School of Medicine in 2009 before pursuing radiation oncology residency at the Harvard Radiation Oncology program, which he completed in 2014. Dr. Aizer focuses his clinical research efforts on the management of brain metastasis. He leads several prospective clinical trials involving patients with brain metastasis, and he published both retrospective and large database studies centered on the management of patients with this condition. His career is devoted to improving the understanding, management, and outcomes in patients with brain metastasis. Thank you for joining us, Dr. Aizer. It is an absolute pleasure to have you here with us today.
Thank you, Leanne. That was a lovely introduction. And it's funny that we're talking more formally than we normally do.
I know.
Really
And for those watching, Dr. Aizer is actually my radiation oncologist. And just on a personal note, he is a truly wonderful human and radiation oncologist, and just, a wealth of knowledge. And I always think you're so special because it's such a niche area that you work in, that not only do you specialize in brain, but you specialize in brain metastasis. So it's kind of like this niche within the niche. At least that's how I look at it. So why don't you start by telling us what you do as a radiation oncologist?
Well, just to respond very briefly, I would say that it's a relationship, man, that definitely goes both ways. And of course, a privilege and honor to interact with you in any way, shape, or form we have the opportunity to do so. So to answer your first question about what a radiation oncologist does, so radiation oncologists train relatively broadly in oncology. The training program is typically about 4 years in length, and we actually rotate through all of the relevant disease sites. And that can be helpful with giving us a background, not only in radiation, but also in oncology in general. And I think when it comes to the brain, one thing that is nice from a radiation standpoint is the ability to try to put everything together as best we can. The radiation, the drug therapy, the surgical therapy, as well as the supportive care and quality of life issues. Not to say that we're an expert in all of those things, in many ways far from it at times, but it's nice to be able to try to counsel patients from an oncology standpoint, not just purely on a radiation standpoint. So ultimately, the treatment we provide is radiation to patients with brain tumors. However, a lot goes into the question of should we radiate in addition to how we radiate. So typically, every radiation oncologist will be different, but in the brain, it's definitely a site where we try to bring it all together.
So when do you become involved in a patient's care, as far as when a patient is diagnosed with metastatic breast cancer that is, spread to the brain? So how do you become involved in their care?
It's a great question. So typically we'll get a referral from either a neurosurgeon if there was a consideration regarding surgical therapy as a first step, or a medical oncologist, or a palliative care physician. So one of the patient's team members will often reach out to us and ask us to take a look at the case and weigh in on radiation and other elements of management. So we typically will get a referral from one of those sources. And that includes inpatient referrals as well.
So it sounds like it's really important too that if you're getting a referral, how you typically start with a patient is through a referral from a surgeon or an oncologist, that the importance exists to work really as a team then with those professions.
That's a great point, Leanne. So increasingly, radiation is just one component of therapy, and a team effort is really integral. So whether that's multiple doctors in the same room with a patient, or multiple independent visits where the doctors are talking behind the scenes, I completely agree that optimal management is really multidisciplinary in nature, spanning medical oncologists, neurosurgeons, radiation oncologists, palliative care physicians, and other